Behind Closed Doors is a series produced by Somerset Community TV, the Skowhegan Women's Club, and the Family Violence Project. This program aims to create a dialogue around domestic violence with the help of special guests and local health professionals. We discuss the many ways our community is affected by this issue and the resources available to help curb and reduce it.
Welcome everyone to part 6 of Behind Closed Doors. This is a collaboration with the Skowhegan Women's Club and the Family Violence Project, Michelle specifically. We want to bring you the topic of elder abuse today. We'll highlight many facts and resources to help as you maybe have experienced or in the future you may have a loved one that will experience elder abuse. So we would like to bring this information to you today. Channel 11 is helping also with allowing us to be here for the hour to share this information with you. And we want to give you the one toll-free number, 24-hour helpline, 1-877-890-7788, that you may contact folks that will give you guidance and next step support. The guests that we have on this panel will introduce themselves so that we'll get their title correct. So I am Deborah Burnham from the Skowhegan Women's Club. I'm the president, and to my left is...
I'm Vi Ferlin, and I'm vice president of the Women's Club.
I'm Michelle Leclerc with Family Violence Project. I'm the community awareness and prevention educator.
And my name's Angela Morgan. I'm a staff attorney at Legal Services for the Elderly.
So Michelle, we'll let you start us out.
Well, thank you so much for, again, having us here. This is such an important topic. You know, today we're speaking about elder abuse because, as we know, abuse can happen at any age. Can happen to anyone, any age. And, you know, there are specific factors that happen when it's happening to elders. You know, so let's just dive in. So what is elder abuse? Does anyone have a definition that they like to share or that they like to talk about?
There are just major categories that we generally see: physical abuse, emotional abuse, sexual abuse. Financial exploitation is the big one that we can help with, neglect and abandonment type of things.
So all those, pretty much all the same ones that affect everyone can also affect elders with some different nuances. Like, you know, if someone has a walker, for example, if they're, you know, if they have someone who comes into the home and helps them, you know, their walker could be put on the other side of the room so that person is confined there. And that can be a tactic of abuse. The different tactics just look different based on the person. Are there other tactics or things that people have seen or heard of?
Maybe wanting some financial support, as Angela mentioned. Maybe you're in crisis yourself as a young mother, or maybe you're trying to buy a house and you're seeking some money from the grandmother, an aunt, uncle, somebody who you hope, you know, maybe give you the money, but maybe with no intention of paying that back.
And maybe they had intention to begin with, but didn't have the ability to really go through with it. And so it becomes a situation where there's that exploitation. Even if it wasn't their intent, that is the outcome.
Right.
And which isn't okay either. Yeah. Are there any other tactics?
I think there's another problem too with the eating habits of the elderly. A lot of them cannot afford to buy food, and they need prescriptions, need medications, so what do? They have to choose between the two, and they need both. So, you know, we have to make sure that they're eating right. We have you know, Meals on Wheels and places they can go to. A lot of people aren't aware of that either, and so, you know, there is a lot of areas that can be focused on that need help.
Yeah, so the struggle already of, you know, older adults living in the crisis of poverty, not having food, having to choose between food and medication, that, you know, makes it hard already. Yeah, and we'll definitely talk about resources for those things as well, because that is such a huge need. Yeah.
I think it's important to note that it can happen anywhere in someone's home or in an institutional like setting, like a nursing home or residential care. Or, if they live with, family members. So it can be anywhere.
Yeah, that's a really good point, because maybe your picture is, at a nursing home, that's what happens, or in someone's home. And to know that if it's in your home, the person that's doing the abuse could be a caregiver coming from the community, or it could be a family member. It could be, if, an older adult is there and, a grandchild or adult child moves in, they could be doing the abuse. And it's also made more complex because of that, right? If it's a family member, they love that family member probably. And so they often will call and, they don't want the person to move out. They don't want to press charges. They just want the abuse or exploitation to stop, which is, it is made even more complex sometimes if the adult, if they abuse that child when they were a child and now they've moved in and are, perpetuating the abuse back. Which is, and the guilt of raising a child that is doing this, there's so many levels of shame and guilt that can happen, that can make it more complex. They may not feel like they're worthy of help because this is their child.
Yeah, we do know that about 90% of abuse happens by family members, most likely adult children, but also spouses or other grandchildren, but family members, so people that are, it's really hard for these people to want to come forward, but it's really important that they do.
Right. And some of the remedies can happen without legal action.
Yeah.
Right.
Oh, yes.
So that's an important thing to know. And like when you call our helpline, it's free and confidential. So knowing that you can talk to us and not have to worry about what's going to happen. We are mandated reporters. So if children are in danger or if we believe you're in danger, we do have to notify, either adult protective or child protective, depending. But those resources are there for you too and for your protection. But please know that it's confidential. And, we don't call the police unless you tell us it's okay to. Because it's a confidential helpline.
And legal services for the elderly as well, free, confidential, and we're not mandatory reporters, so everything that's told to us, it's completely the highest standards of attorney-client relationship, and we know that it's largely unreported, so we're doing things like this is very important because a lot of people just don't realize that they really need to come forward, or if they see it from other people encouraging the family member, there's the study that only 1 in 14 elders who are abused will report.
Wow.
So, yeah.
That's not very many.
No.
That's really scary. Because that means a lot of people are living in situations where, they don't feel safe. Maybe they aren't getting the health care or medication they need or the food or water. Because it can look so different to people. It can be unreasonable confinement. So maybe just in one room or in a basement, deprivation of food or medical care or medication, isolation, preventing access to walkers, to hearing aids, not bathing or assisting them when they need. Right. And that is very uncomfortable. And we think of, these are the people who raised us, they've lived a long life and they still deserve that dignity. So to be living without that is, that's traumatic for them. So that's really scary.
Yeah, and it's happening. There was a 2010 study that reported 11% of the elderly population in the United States had experienced abuse or neglect in their year prior.
Wow.
So 11%. And that's abuse or neglect, but so we really need to reach out to our seniors in our community and check on them.
Yeah. And especially as seniors too, loneliness, being isolated, really feeling like you're all alone, and who do you reach out to? If it's not a family member or that family member is the issue. Where do I go next?
Right. And so, it's an intentional act or failure to act by a caregiver. What are some other risk factors? So it sounds like living alone or just living with that one person and that's your only source of support. That can be a huge risk factor if there's only one person involved in the care, and because that creates burnout for that person too, which, so some of it may happen unintentionally just due to burnout. But if it, is intentional, that's the one person that's in control. So that creates a dangerous situation, because if they're controlling all aspects and choosing not to do things, that person is on their own. What are some other risk factors people can think of?
Well, so we have a lot of training experience with people with dementia, and that's a very broad term for any sort of memory loss, but it definitely is a risk factor. People will, just that in itself, they feel that there's something wrong with them, or and
Well, it's a vulnerability,
Yes.
and it makes them a target by people who are choosing to abuse, because they will think no one's going to believe you because you have dementia. Everyone knows me and knows that I'm upstanding. They won't believe that this is happening. And Maine Public did a program called Broken Trust. You can look at it up on their website, and it's so sad. It's about an older adult who's in a nursing home who was targeted because of dementia, and it's heartbreaking because people didn't believe him because he had dementia, which was really sad. And it wasn't until the person was caught abusing him by another healthcare provider that he was believed. So it's really sad. So for folks with family members with dementia, please check in with them, and if they say something is going on, believe them. Yeah, it's really scary. Isolation, we talked about that, and abuser dependency. If someone is living with someone by their necessity, not just the older adult's necessity, but if they have nowhere else and they're depending on that person for their livelihood, that can create an unsafe situation too.
And we also see, after somebody's been hospitalized or they have poor physical health, that's a huge thing to just as a risk factor, because if you become very dependent on others, and you're vulnerable.
If you see that the caregiver is the only one speaking for someone and not letting the person themselves speak, that can be something too. If they're always speaking for them and not ever letting the other person speak, and they may have good reasons for that, like they don't feel good today, or I can just be so much clearer. They may have reasons, but it's important to let that person speak. Any other thoughts?
I think at the Elder Abuse Summit, it was brought up that either the perpetrator of the abuse or sometimes the victim may have mental health problems or substance abuse problems. So either of those could be risk factors.
So, were you going to say something?
No.
So what are some signs that may be apparent if someone's being abused?
Something bruises or something, not wearing glasses, if they're usually a person who has to have glasses.
I've seen elderly people that their hair is all matted. It needs to be shampooed, or they have bruises. And they don't like to tell you, I hit the bed, or I hit this and that. And you know very well that that's not what happened. I took care of both my parents. My dad, he was 94, and my mom was 88. And they apparently, after a while, they were at home. I was getting too much for Mom, so I placed them at the Reddington home, and they were very well taken care of there. But I was fortunate because either one had dementia. They had their wits about them right until the dying breath, But I just made sure I went every day to make sure that they were eating, that they were clean, that they were happy. And it made me feel good. It makes me feel good that I was able to do that. But a lot of people aren't. And then so many people in nursing homes are put there, and nobody comes to see them. They stay there. And I know one dad was in the nursing home 1 week, and somebody came into another room with a bag of groceries, left them there, and they said, "Okay, see you next week." And that was treats for that patient, but that was it. He just brought them in and didn't even visit. Left them there and said.
And it is hard in rural Maine, like with geography, depending on where people are where they are, and income, and if I think transportation is such a huge barrier,
Right.
and some people struggle seeing their loved ones
Right.
decline,
Right.
which is really sad because that
is.
person still wants to see them.
Right.
Oh,
And
yes.
yeah.
Right.
So, but having someone come and visit, that's huge.
Mhm.
That's great for the
Right.
person, for their well-being, and to check in and make sure everything's okay and
Yeah.
that they're being
Yeah.
taken care
Right.
of.
Yeah.
Yeah.
Yeah, I think it's important to, if in your community you see a change in somebody's routine,
Right.
the elderly seem to have a certain
Yes,
routine about them.
yes.
They go to church or
Yes.
they are
Yeah.
always at the bingo. And
Right.
if they stop going to those
Yeah.
things, it's important to check in on them
Right, it
because that could be
Mhm.
a red flag for
Mhm.
sure.
Yeah, that's a really good one. And seeing, if they seem depressed or confused, if they're showing like signs of trauma, like if they're rocking or withdrawn, those things can happen. If they've lost weight, like suddenly
Yes.
and for no apparent reason,
Yeah.
that can be one. And if they stop going to activities that they enjoy. If they look messy, like you were saying with
Yeah.
matted hair,
Yeah.
if they look messy, their clothes aren't clean, it doesn't feel good to, be
No.
showered or
No.
have your
No.
clothes dirty.
No.
And so if that stops suddenly, to see what's going on, or if they develop bed sores or other preventable conditions. And again, if they don't get to speak for themselves, if someone else is doing all the talking for them,
Right.
raise some questions.
I think there are some people though with dementia that don't want to be cleaned up. They fight
Resist.
the issue. They don't want to shower. They don't want to brush their teeth. They don't, and you have to persuade them to. You have to do this for your hygiene. You can't just not clean. You have to be clean. But I've known of cases like that they just did refuse to take a shower and didn't want to do, just not even brush their teeth, and
So the caregivers have to
Yeah.
go through the back door and try
Try,
all
yeah.
kinds of tricks to
yeah,
try
they
to
do, I
get
would
them.
think,
to-
yeah.
Yeah. Well, that
hard.
loss of
Yeah.
independence too, and
Yes.
having to have someone help you, that's scary.
It is
and
scary.
that feels, for your dignity, that
Yes.
loss of dignity and needing someone
Yeah.
to help can be scary to admit and scary to deal with, even though they're there and they're trained and
Oh,
they're
sure.
professionals. So yeah, sometimes it can be because of the patient or because of, the person. They're resistant.
Yeah.
But yeah.
I
Good
think
point.
another not physical sign, but one we often see people come to us with is all of a sudden certain bills not being paid. A lot of elders are on fixed
Yeah.
incomes,
Sure.
and if they've always been able to manage, and then all of
Right.
a sudden, they're not able to pay their light bill, and or they come to you like there's probably exploitation, or there could be exploitation, and a lot of abuse is coupled with another form of abuse. So if there's verbal abuse, there may also be financial exploitation.
Right.
Yeah.
So,
Right. Complicated.
complicated.
Sometimes it's.
It can be very complicated, and I'm glad you brought up that verbal abuse, because that emotional abuse is abuse also, and I think people do overlook it because it's not physical.
Right.
But the put downs, the verbal, telling people that they're stupid, telling them that they can't do things right, using their religion or beliefs against them, those things are very debilitating too. You think of the spirit, like that hurts you internally, that hurts your self-worth, and so those things are abuse also.
Yeah. True.
Yeah. So what are some protective factors that people have that help, keep them safe in their homes or in their communities? What are some things?
I think staying busy and engaged with your community is important. If you can, if there are things you enjoy, whether it's your neighbors or your church, or giving back if you can. If you're making your social network as big as possible.
Yeah, that's huge.
Yeah, through my church, I every other week I go visit shut-ins, and they're always so glad to see me. Some of them, I'm the only one they see.
Wow.
Others have family, but I go every other week and visit many people. I enjoy it, and I'm learning a lot of things from them. How a lot of them are really smart people, especially the ladies with their hands, the work that they do, the beautiful handwork they do, and then a gentleman too. But I've been doing it now for several years, and I plan to do it longer and have maybe more people. But that's a good outlet, to
That's
see these
really
people.
nice.
Support
If they
them.
knock on the door, it's me again. Oh, we're so glad you're here. It makes you feel good.
Makes
And I
their
bring them
week.
little treats.
Yeah.
Some of them don't get treats,
Yeah.
and so I bring them candy and little things that I make, and it's rewarding.
I
That's
also
social.
I volunteered with a program, the Search program, through Catholic Charities, which is a similar program. And
Stipend Catholic.
yeah,
Yep.
and I think it's important if you know somebody who is isolated to encourage them to sign up for these free programs, because that person, seeing them once a week may be the person that they look forward to, and there are volunteers out there to do that stuff.
Right.
Yeah.
Right. Meals on Wheels. That's why I
Yes.
think that
Yeah.
people so
Right.
appreciate
Right.
not only the meal, but that
The
human is going to knock on
Yeah.
the door, bring them the food, and talk a little bit.
Yeah,
Get to
that's
know
right,
them
the
as a person.
contact. Yeah.
And be rewarded with that information back.
Yeah.
So the two-way positives that come from it.
And Meals on Wheels also helps pets too now.
Oh, really?
Which is really nice. I believe, I know the Waterville one does. I
Uh-huh.
don't know about Skowhegan. I would imagine they did too. So they'll bring
Yeah.
meals for
Oh,
pets because they
nice.
found people were sharing their food with their
Yes.
animals.
Oh,
And they
sure.
were like,
Oh, sure.
wait a second,
We'll
let's
get to
find
that.
another way to help both of you. Because
Excellent.
that
Yeah.
is,
I agree.
our pets are so special.
Sure.
So of course we're going
Yeah.
to feed them.
I'm sure.
They do that in Skowhegan. I
Oh,
have.
good.
Oh,
Yeah,
good.
I've seen
You know
that. Yep.
Good.
Cool.
Yeah, and I think planning ahead for making sure you to consult with somebody about maybe should you have an advance directive or a power of attorney, or have you thought about what you'd like your later years to look like, and be communicating that with people. And one thing that I always take a moment to say is, a lot of when I give speeches to groups, which I will do on request, is not to add people to your bank account. We see a lot of seniors who say, well, that way if something happens to me, but there are a lot of legal ramifications that they might not have thought about by just adding somebody to the account as an owner. It does make them an owner. So I would caution against that, to protect yourself. Just don't add people to accounts without consulting with free legal help, or
Sure.
Yeah.
Good.
So having lots of social supports, lots of activities. If you do have a caregiver, having them engaged in programs for respite
Right.
is really important, and having them have, caregiver supports. There are agencies like Spectrum has caregiver support groups, and they have like the adult daycare. So if you do need 24/7 support, going to adult daycare so that person has the day to, either do self-care or do errands or do things on their own, just having a strong social group is the best thing for everyone, really, because people notice if you don't show up, if your behavior changes, having those strong social supports is so important. So what can people do if they're experiencing elder abuse, or if they're worried about someone who they're worried they're experiencing elder abuse? What are some resources?
Yeah, so I think if you can't have the person call themselves, you can always call Adult Protective Services, and they would investigate. But I would obviously encourage you to have the person call Legal Services for the Elderly. You can assist with the phone call, but they do need to be on board with getting those free services. But you're gonna speak with a lawyer within in a day or two, and really, and sometimes it doesn't involve the police. Sometimes it's just sit down. What are my options
Knowledge.
for protection?
Sharing
exactly.
knowledge
Sharing
that they
knowledge.
didn't know.
Yep,
before.
and it's the person decides. We don't,
Right.
we let our client call the shots on what goes forward. It might be a lawsuit. It might be a protective order. It might be nothing. It might be a no trespass order. It might be just a mediation with the family member.
True.
So there are a lot of options.
So if someone was to call you, what happens next?
Okay, yeah. So we have a helpline, and it's open from 9 to noon and 1 to 4 every day. We have an intake paralegal who will take your name and information, and then an attorney, one of our helpline attorneys, we have 2 full-time helpline attorneys, will call you back within a day or 2, depending on the nature of the. If it's physical abuse, you're going to get a call right away. In financial exploitation, those things bump you up the list. But if you have a common question just about a will or something like that, it might be a day or two. And then the helpline attorney will give you legal advice based upon Maine law. And if you do need anything in court or an in-person visit, that's when the staff attorney will be assigned. So then that's when I will get assigned, and we have 7 other staff attorneys to take. We serve the whole state. So if you have a loved one up in Aroostook County or wherever, definitely in this area as well. Then I do a lot of in-person meetings, because transportation
One-on-one.
is such a problem. It's hard for a lot of elders to get out to a lawyer's office, so I will come to them or a safe space in the courthouse or somewhere we can go, and we'll talk about our options and their rights. It just to tell them that they deserve dignity and respect, and I'm there to help them whichever they want to go. And it might just be referrals to to social service agencies, or it might be court action, depending on what their goals are.
Nice.
Yeah.
That's great. And all those services are free.
All free. Yep.
That's amazing.
Yes. Yep. 60. You have to be 60 and above.
Okay. That's
And a Maine resident. But
Okay.
other than that, no other 60 and above Maine resident.
Good.
Nice.
Yeah.
Yeah, people can also call Family Violence Project. We have our 24-hour helpline, the number that Deb gave out
Right.
before, the 1-877-890-7788, and we'll have that on the screen also. People can call us 24/7 just to talk to us about what's going on. We will never tell people what to do. We're there to provide options and really just listen. That's one of our major things we can do,
Right.
because especially after, if you don't have supports to talk to, we are there to listen and hear what's going on and then give you options, and it's up to you to choose what to do. We can help with protection from abuse orders if that's someplace you want to go. If you're, being abused by your caregiver or by your family member that's living with you, we can support you with that, or a protection from harassment order, whichever. We have court advocates. We are not lawyers, so we would probably reach out to you folks.
Sure. Right.
But we work well together to get you the best support possible, because we just want you to be supported and safe, because everyone deserves to be safe in their homes.
Right.
That's so important. And we do have support groups that are for all ages, but people, often find support. Peer support is always amazing, just
Right.
having other people going through similar things. It's so nice to just hear, how other people have gotten through it, that, just the fact that other people have gone through it, and just because something is over doesn't mean you aren't still feeling the effects. So it's okay to be
Right.
around other people that are experiencing that too, because the world might be like, oh, well, you need to move on, that's in the past, but those traumas stay with you. It takes time to heal from those, and so that's really important. And we can do referrals to other agencies too. Martha's Cottage is a shelter for older adults, and they're amazing. They're in southern Maine, but we can help connect you to them as well. And we do have shelter programs, but emergency shelter can sometimes be challenging for people.
Sure.
If there's 7 kids in shelter,
Sure.
that may not feel like a supportive or safe environment for someone. That might be a little overwhelming. So that's why places like Martha's Cottage, we really appreciate them. Because 7 children is a lot for me.
Right.
When I go to shelter, I'm like, wow,
Well,
okay. But so sometimes that's not the best place for folks, but sometimes it is. Kids give us life too.
That's
So whatever, we want to support people wherever they're at. The Ombudsman program.
Yeah.
Do you want to talk about that?
Sure. So we work very closely with them on certain cases. The long-term care ombudsman program is a free advocacy program that's in every nursing home and every residential care facility, but also oversees the state's home care services.
okay.
So they have, if you're getting any of those services for care, they are there to tell you about your rights and to be a voice for you if you need it. And we get a lot of referrals from them. We'll take cases if somebody's being discharged from a facility, or if they're losing some of the hours that they were given in their home to take care of them based on a recent assessment, and they need to appeal that to the state and try to keep their hours, keep them safe. So we'll work with the ombudsman for that. But they're a wonderful organization for anybody who gets those types of services.
Nice. And their phone number is 1-800-499-0229. And we'll try to have that number afterwards also.
Right.
And then you mentioned adult protective services. So if you're ever worried about an adult, and this could be an older adult or an adult with any sort of disabilities, or any adult that you're worried is being compromised and doesn't have the capacity. They talk a lot about capacity to make decisions or protect themselves. You can also call them and they can do an investigation as well. And their number is 1-800-624-8404. And, because they are there, they're there to keep people safe as well.
And they, you have an option to fill that report online as well, and it can be confidential. You can choose not to disclose your information and just do a report. If you are suspicious something's happening with your neighbor or a loved one, and you want them to look into it. And if APS goes out and the person has capacity, they'll often refer them to us, legal services for the elderly, so that we can, if the person wants representation, they can have it. So I think APS is a good place too if you're worried about somebody.
Yeah. Thank you. And if you're a friend or family member in your ward, you can also call Family Violence Project. We serve survivors, but we also serve anyone in the community. So if anyone's worried and wants to talk to us too, you can absolutely call and speak with us. And then some other community resources. You mentioned the search program. So
Yes.
do you want to say a little more about that?
Yeah. So the search program is run through Catholic Charities, and it stands for Seeking Elderly. I forget the other two things, but it's seeking, and it matches people. You'll fill out a questionnaire, and if you say you just, the woman I visit just needs me to visit with her, I bring my kids and we go and see her on Sundays just for a few hours, but they can also match you with a volunteer that might be able to help you stack wood, or various, take you grocery shopping, or so the volunteers are just people who they do background checks on these people, and they do follow up. They called all my references, so I know that they they're very vetted, so you can trust the program, and they just are there to prevent isolation, because really that does lead to so many problems and barriers to seeking help when you're isolated. So yeah, it's a great program. So Catholic Charities, I think they're statewide. So
So they help people with companionship, or it sounds like what you do when you bring your kids out is about companionship and community, right?
Exactly.
But they'll help with tasks and with all kinds of things. That's so cool.
Yeah.
That's very.
That's nice.
Yeah.
Spectrum Generations is another
Right.
one.
Yes.
They're very active in the community. They have the Meals on Wheels program, which we talked about. They will support people with making their Medicare insurance choices as well. They are very informed. That stuff is so confusing.
Oh yes.
And it changes all the time.
Yes.
So they have people who are very educated about that and can help support people in making those decisions. And I believe they're the same empowerment based of they give you the information and you get to make the choice that's best for you.
And these are all free services.
Yes.
And I did Legal Services for the Elderly also has a Medicare Part D unit. There are, as everyone with Medicare knows, probably there's over 20 different Part D plans, which is what covers your prescription drugs. And they change every year, the formularies. And the Part D unit will help you if you're having trouble anytime with prescriptions getting covered. So they'll either help you switch the plan, or they'll help you deal with the doctor to get the coverage. We never want somebody showing up to a pharmacy and walking away because they can't afford their medication.
Right.
Yeah. So.
Which is really, I feel common, because the prices are getting really high, and it's scary. If you have to prioritize rent or a medicine or feeding, that's when there is absolutely a problem. So being able to reach out to you, being able to reach out to Spectrum is very important. Being able to reach out to your doctor. Sometimes your doctor can make a change so that you can get your medication. They have a Money Minders program at Spectrum Generations, which, if you're having problems, managing to pay your bills, or, and it's hard because sometimes, in some relationships, one person has always been the person to deal with the money. And then when that person passes, you're left saying, oh my gosh, I don't know how to do any of this stuff. So being able to have support around that can be really helpful, learning how to budget, just being able to manage that stuff, because it is very overwhelming. And that's been helpful, if something else is going on too, that's where, so we might see exploitation of like, they also have a scam alert program to let you know about scams, because there are different things that can happen, like the online boyfriend. People have been saying that they'll meet someone and, they might be in another country and they need some support, like, which we know that happens. But if you're, and we want to support you in choosing to do what you want with your money, but if it's keeping you from paying your rent or your house payment, that's where it can be dangerous. So helping, they're there to help support. And we all are really, how can we support you in making these decisions so that you still stay housed and fed, but still spend your money how you want. So scam alerts, like that boyfriend scam, but like there are all kinds of other ones too, like the IRS. I don't know if people have heard about that. The IRS calling saying they're going to arrest you. That is a scam. The IRS would never call you. They would never arrest you in that way. So, if you get something in the mail that seems a little fishy, there are supports out there to help you navigate that. They have aging in place support, adult daycare, and caregiver support. Those are all really important things. And I know in Waterville at the Muskie Center, they also have, activities for folks. Like, you can play cribbage or bridge.
A connection, a little group to go to.
Having those social things and having, those supports, so that again, like if you don't show up, people are going to ask, like, okay, where's this person? What's going on? And those are such important things. What about age-friendly groups? Do people know much about those?
Yeah, there's I know there's a group in Augusta. We, of course, are on a task force in Augusta, the Greater Augusta Area Elder Abuse Task Force. And I know there's a Augusta age-friendly community. I'm not sure about this area. I know they're expanding everywhere, and there's a big push by AARP to help fund these programs. And, so I think it's a big, we want people to be able to stay at home and feel connected to their community as long as they can. And so you definitely look into those resources.
Our program is going to start in Skowhegan.
AARP.
AARP at Main Grains. Miller's Table is the name of the restaurant. They'll have speakers, and then they're going to have coffee and scones and muffins, and it's all free.
Nice.
So to have people come and listen to maybe new things that are happening. And so it's going to start, I think it was the 23rd
of
June.
Oh, cool.
And the community, the extension office too. They have programs.
They
that
do
teach
once a month on Wednesday.
Right.
Yeah.
Elders, anything they would like to focus on.
And if they want to play cards or do games or just talk and sit, or they usually have food. And it gets people out.
Right.
Well, food, we bond over food. Who doesn't love food? Like, that's such a, it's just that extra incentive when you're like, because going out is hard sometimes, especially I think about winter in Maine is so isolating. So, that's a little extra incentive, because who doesn't love a free scone or a free muffin?
That's right.
And so age-friendly groups often will help with navigating those things so that people can age in place. So like it might be transportation, it might be shoveling snow, or getting people the buckets of sand.
Okay,
because like maybe you can spread the sand yourself, but getting that huge bucket of sand
near your door.
So if that group is starting up here, that might be a way that they can help, because those things just make it easier to stay home.
And my neighbor, in fact, said that I believe Skowhegan High School athletics, some of their programs do send their brawny athletes out and to give to community people the sand in a bucket before winter starts. That's something they tried to do to connect with the elderly, which is because my neighbor had that happen to her. She's able to have the sand always by her door because this young group comes every year and make sure. And I was thinking of her. She's 90 and she is connected with the communication center, Somerset
Yes.
Communication
Right.
Center,
Yeah, she
and
is.
she gets a call or she calls them by 11. If they haven't heard from her,
Ah.
they check the
Yeah.
next person on her list, a daughter.
I have
It-
heard about that, and that is
Yeah.
unique to this community. And I
Yes,
think
it
is.
people
Wonderful,
use that,
and she
yes.
loves
Yes,
it because
right.
there's that
Yeah.
friendly voice. Hi, this is Edna. I'd like to say, how are you today? I'm fine, and look at the weather. Stay in because they've said it's going to be a storm. Make sure you don't get out there in the middle of it. So it's just that nice voice
Yeah.
that she hears every day, 5 days a week, and loves it.
That's really nice. And that's through the Skowhegan Communications, like
Right.
the dispatch.
Uh-huh.
Yes, it is.
Yeah.
That's really
Yeah.
nice.
It's very wonderful.
Yeah.
She loves it.
She does.
Yep.
Yeah.
That's wonderful. And then the mug clubs.
Oh yes,
So
yeah.
yeah, they're healthy aging social gathering places across Somerset County.
Uh-huh.
And we'll put this up. There are places all over. There's Cambridge, Canaan, Fairfield, Jackman. They go all the way out to Jackman, Madison, Mercer, all over.
Excellent.
Let's see, Moose River, New Portland, Skowhegan, and Smithfield. So they are all over the place.
Right.
And these mug clubs, they're for socializing, learning, connecting. Someone in the community will lead it, and they'll give you opportunities to talk about what you want to talk about. And learning, lifelong learning helps the brain keep sharp, which is what we all want. And they have evidence-based prevention and movement or healthy living programs. So they might do the balance classes or different classes, based on what people ask for. And, they have socials, games, book clubs. It sounds like it's really group driven, but gives you a place to go out. So we'll put this on the website or at the end of the video, we'll pan over this so that you have that information, because all these things, staying connected, I guess we say it over and over, but it helps so much and it feels good, right? Like we're people, we want to be connected. That's how we live.
Stimulated, yeah.
Yeah, and you can look at your hospital for classes as well. Just different classes to stay active, to stay together. Well, I think we might be wrapping up early. I hope that's okay. Does anyone have any last thoughts or anything else that they want to talk about or any takeaways?
I would just quickly mention 211 is a good resource for just any, they have a broad variety of agencies that they know about. So if you have a general question about what's available, 211 is always good to go. And we do always recommend Spectrum Generations, like getting a benefits checkup. If you, haven't looked at, would you qualify for heating assistance or food, supplements. We do know that a lot of the elderly don't take advantage of these programs. They might be misled about different things about them, but if they haven't had a benefits checkup, it might just that added $40 a month might make a huge difference.
And they're proud,
yes,
right?
they're proud.
They're proud.
But they work their whole life.
Yes.
They should be able to,
Right.
live a good life.
Sure.
Them. Yeah. So. And there was one thing I wanted to bring up quickly about. In Maine, there's estimated 33,000 cases of elder abuse a year, so it's a lot.
Wow,
It's a
that's
lot. And so it's very important. No one likes to talk about it, but we really need to
Yes.
help our
Thanks for
you
bringing
know
that up. Yeah.
yeah. And it might be your neighbor, or it might be somebody you have your old high school teacher, or
Yes.
somebody just
Right.
just realize that it's happening, and there are resources to help.
That's the
Mm.
good part.
Yep.
Yeah. Yes. Thank you. And so if think about it, reach out to people, build those connections. And if something doesn't feel right, it's okay to call and just talk it through and talk about what you're seeing. Because if you don't have a good feeling, trust that, I think it's really important, whether you're, the individual receiving care, whether you're a family, friend, or loved one, or it maybe you're someone who does in-home care every now and then, but something just doesn't look right. All these resources are here for you too, to reach out, because we want everyone to be safe in their homes.
Right.
And another reason is it leads to premature death. There are a lot of, you know, the statistic is elders who experience abuse, even modest abuse, had a 300% higher risk of death when compared to those not abused. So, you know, if you don't speak up, or if you know you don't, if you ignore the problem, it could lead to your death. So, you know, we really want you to reach out or reach out for those. The victims, you know, have so many barriers, and sometimes you just need to be really encouraging and supportive, and
Yeah. And that's really scary. Like, that's such a scary statistic. And if anyone's watching this and thinking about a loved one that they, you know, that maybe has passed, that they wish that they had said something, please know you can still call and talk to us too. I think I worry that, you know, some of these things that we've said have, you know, will bring on guilt and like, oh, should have, would have, could have. Sometimes you don't know things until after. Like, the trauma of being in the moment, like, you know, doing caregiving, having a loved one with an illness, you know, slowly declining or even quickly declining, that's really hard on you. And when you're in it, it's sometimes hard to see these things. And that's why having multiple people can be helpful, because, you know, it maybe someone will see it, or you have like a little, you know, it's easier to step outside a little. But if, you know, something has happened, and, you know, even if it's over, know that we're here to talk about that too, because it's a lot to bear. And retrospect is 2020. Like, that's how it always happens. Like, I should have done this differently. And I feel like when people do pass, there are already so many things that, like, I wish I had done this different. And so if some of this is resonating, and you're like, I wonder if that was happening, you know, please know that we're here to support you too.
Wonderful.
Any other last thoughts?
I think with the support information that we'll scan with the Channel 11 folks, that references, resources, numbers, agencies, then that will be review for people when they need it, when they see it.
A big help.
we do have an elder rights handbook that if you give us a call and you'd like one, it's based upon Maine law. It has sections for different categories, and it's really easy to understand, big print. So if anyone's interested in that, it's also on our website. But that's a really good resource if you want to learn some more about the topic.
Nice.
Yep.
Perfect.
Wow, thank you so much for having us. Thank you for being here, Angela. This was really great. And if you have any questions, please call our helpline 1-877-890-7788. Have a great day.
Thanks.